Sound check. All right, guys, we're getting ready to get started here in about 1 minute. Thank you so much for joining us. We'll see you really soon. Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Happy Monday, guys. Hope you guys had a great weekend. And next week, happy Father's Day to all those great dads out there. The title of tonight that I'm going to be going over is Help, I Have Chronic Pain. Okay. So this is going to be interesting, but I'm going to help you to see chronic pain from a little bit different perspective. Um, Maybe a little bit different perspective than what most chiropractors are actually claiming or maybe advertising. But I'm going to help you see it from a little bit different perspective when you talk about chronic pain and things like that, and help to start seeing it how I see it, especially. So if you're watching right now, say hello. Let me know where you're watching from. If you're watching on replay right now, we're broadcasting live to Facebook at Dr. Nathan Thompson, Facebook at The Wellness Way Yorkville. Also on my personal page, just so you know, if you're watching it from Facebook, it will be deleted within 30 days because that's just Facebook's live policy. But also broadcasting on YouTube and also on the awesome Rumble platform. So if you're watching from there, make sure that you say hello and also let me know where you're watching from. It's good to see a lot of people from so many different areas. And wow, we have a lot of people that are watching right now. So good to see you guys. But I'm going to talk about chronic pain and make sure that if you know someone, if you might suffer from chronic pain, or you may know someone who suffers with chronic pain, and if you do, make sure you forward this video to them. Please help them to watch this to give them some answers of maybe they might start seeing it from a little bit different perspective. Okay. So chronic pain is absolutely huge. I'm going to show you here in just a second. And just remember this, coming up is our inflammation talk. And yes, chronic pain has to do with inflammation. I'm going to talk about that here in just a second. But if you are someone who suffers with chronic pain and you're from the Chicagoland area, please make sure you get registered for our next inflammation event that's coming up tomorrow, which is June 10th at 6 o'clock p.m. This is an in-person event right here in Yorkville, Illinois. Starts promptly at 6 o'clock. But really, when you talk about inflammation, everybody thinks it's all with chronic pain. But one of the amazing things is inflammation has to do with weight loss resistance, cancer, infertility, thyroid disease. And here's something interesting, and this is just today. Just today, we've had 2 people be able to get off of thyroid medications. I bet the endocrinologists are just absolutely floored that a stupid chiropractor is able to help people get off of thyroid medications. Okay. Chronic joint pain, type 2 diabetes. I'm going to talk about that here in just a second too. autoimmunity, and yes, inflammation is absolutely tied to your hormone balance and things like that. So if you need help and you want to work with the Wellness Way approach and work with me directly and you're from the Chicagoland area, please get registered for that event that's coming up. All you have to do is just click on our Linktree profile. You'll see it on all of our socials, and click on that. You'll probably see it even in the chat of this page. And if you click on that, one of the first things you'll see is all these links that come up. The first one will be to the inflammation event that will guide you to Eventbrite. It takes you 60 seconds to register. It's a free event. Make sure that you get registered for that. If we don't have room, I apologize. You're just a little bit late to the ball game, but our next one will be 3 weeks from tomorrow. So if we don't have room for you to be able to attend, then 3 weeks later is your time to get registered for that event. So make sure that you don't delay. Make sure you please get registered for that free event. We have a gift for you, obviously, at the end. But just remember this: if you register for it, you're committed to showing up, because great things happen when you show up, especially. So please make sure you get registered for that. Okay. Now, just so you know, next week's topic, I already have a topic, so I'm a little bit early to the party. So next week, I'm going to be talking about understanding POTS, okay? Postural orthostatic tachycardia syndrome. And so these are people who, when they change directions or they get up from a seated position or get up from a laying down position, their heart beats really fast. They might have some dizziness, things like that. I'm going to help you to understand that. And some of the chemical, physical, stress-related issues that are involved with that. But I'm going to help you to see it from like a real simplified perspective. And so make sure you join us on that next live broadcast. I think that's going to be interesting, because I think some of the things that I talk about are going to open your eyes quite a bit, and probably you'll have an aha moment. You'll say, "Oh my goodness, this is when this started to happen too." So interesting enough is, if you look at people with POTS, one of the things you should look at is alar instability, infection, recent vaccination, things that are really downregulating the adrenal glands, especially. So make sure you join me on that live broadcast. I guarantee it's going to help you out, or help someone who is suffering with POTS start to help them out as well. So make sure you join us for that live broadcast. Make sure you subscribe to our channels and get notified when we're going to be going live. Okay. So let's go over chronic pain. Okay. Chronic pain. Now, I have suffered with chronic pain in the past, and quite honestly, it really sucks. I mean, it really does. It can really destroy your energy. It can destroy your clarity of thought. Yes, it can even lead to depression and sleep deprivation, things like that. But if you look at in the United States and you look at chronic pain statistics, 1 in 5 adults suffer with debilitating chronic pain. Okay. Now, I have seen people who have come into our office and they have had debilitating chronic pain so bad that, they had them on some very powerful narcotics that absolutely wrecked their gastrointestinal system, caused some issues that you had to work through that as well. But 1 in 5 people, a little bit more than that, are suffering right now with chronic pain. 8 out of 10 patients, so 80% of people who have chronic pain, are affected by severe depression. Okay. Now, here's what I find so interesting is that, when people are sick and they're dealing with chronic pain, it's almost like, well, if we can make you happier, then your pain's going to be less. And yes, there is an inflammatory component to pain, but yes, there's also some changes that can take place in the brain when associated with chronic pain as well. And I don't think that the chronic pain is causing the depression as much as what's driving the chronic pain is actually leading to depression as well. 1 in 4 people who live with chronic pain have problems sleeping, which means there's really no hope for them to be able to repair, because one of your repair mechanisms is actually to sleep. And 10% of the world's population is affected by chronic pain. 10% of the world is affected by chronic pain. So now you're actually looking at hundreds of millions of people who are affected by chronic pain. This is a real big issue, and we need to start looking at it from a different perspective. This is what I always say, as if what you're doing is not working out, then maybe what you need is start looking at it differently. And that's why, in the Wellness Way, we say, I help to solve problems that other people can't by looking at things from a different perspective. And that's why, earlier today, we've had 2 people who have been able to get off of their thyroid medications, and they actually have normal thyroid function. This is one of the things that just absolutely just floors me, is that there's so many doctors who are so quick to go on a medication, And so they know when to medically prescribe, but they have no idea how to build a person's health so that they might not be able to need it as well. Also, a person be able to get off of blood pressure medications and things like that. So your doctor is an expert into giving people medications, but I'm going to tell you something. They're not experts into knowing how to build your health so that you don't necessarily need to be on the medication. I think this is one of the most important things that you can do. Okay. So the big idea, what I'm going to talk about tonight, and you have to ask this question: why are we so inflamed? Why are we so inflamed? And in fact, if you look at a lot of people here in the United States, we are very, very inflamed. You don't have to look very far. In fact, go to Disney World and look at the amount of inflammation that people are dealing with. It is just, it's sad in order to see people suffering when there's a better way, when there's a better approach. And in fact, a lot of people just don't know about it. Okay. So why are we so inflamed? Well, you have to start asking the question. Inflammation comes from sources, and where are these sources actually coming from? I talk about this at the inflammation event: physical, mental, chemical, physical, mental, chemical. In fact, this is actually the whole idea of chiropractic, is that the body is designed to heal. And if you're over inundated with too many physical, mental, chemical stressors, then the body stays in a perpetual state of inflammation. It just can't overcome that. And so we have a lot of physical stressors that are going on. We have a lot of mental stress, and we also have a lot of chemical stressors. I'm going to talk a little bit more about that here in just a second. Okay. But let's talk about the big idea behind what I'm going to talk about tonight. But I want to ask you guys a question and put it in the comments, because I want to see what people are actually saying when they talk about inflammation. Okay. So when you think of inflammation, when you think of chronic inflammation, what comes to mind? In fact, I ask this question at every inflammation event. And you know what people say? When I say the word inflammation, they say pain, redness, swelling, heat. And I'm like, yeah, you're absolutely right. Yeah, because what you're describing is you're describing acute inflammation. If I sprain my ankle, yes, it's going to get red. Yes, it's going to get swollen. Yes, it's going to get warm. Yes, it's going to be painful. And I asked them, should that be suppressed? Is that a good thing or a bad thing? And everybody says it's a bad thing. I'm like, nope, it's actually a good thing, because inflammation in the acute stage is actually needed in order to bring resolution. So what it appears when people have a lot of chronic inflammation or chronic pain, then they have what is causing the inflammatory response, but they're really suffering when it comes to the immune system to bring any kind of resolution to it. And that's why you have to start looking at it from a different perspective. So inflammation in and of itself isn't bad. In fact, if you have first exposure to some kind of pathogen, then you're going to have an inflammatory response. There's no way around it. If I sprain my ankle, you're going to have an acute inflammatory response. You cut your finger, you're going to have an inflammatory response. And we're taught that all you have to do is you got to suppress it as much as possible. But that's actually not true. Okay. So if you understand inflammation is the process of your immune system. So inflammation is coming from your immune system to repair and heal damaged or otherwise known as injured tissue. Okay. So it's actually a good thing. It's something that you in fact need. This is why I don't recommend rest, ice, compress, elevate, or something. Like, let it get inflamed, because everything the body's doing is the right thing in order to bring resolution to it. In fact, if you want to be sicker longer, take a bunch of medications from it. Don't figure out why it's happening, and then try to baby it as much as possible. But the question I want to ask is this: what happens if you keep causing it or you can't shut it off? This is why, if you can't figure out what you're doing to cause the inflammatory response or cause the tissue damage, or maybe you don't know what to do in order to shut it off, this is where inflammation and chronic pain and things like that can be absolutely debilitating, which is why we have a lot of people that are out there and they have autoimmunity, and doctors just don't know what's causing it or what you can do in order to start shutting it down or get some kind of resolution when it comes to that. So one of the things I want to tell you is this, because hopefully there's a lot of people who come to my office that are watching this and they think, all my joints hurt, I need all my joints adjusted. So biggest thing I want to tell you is this: if one joint hurts, I want you to think like a localized type injury. But if multiple joints hurt, then one of the things I want you guys to understand is think something is happening systemically. So if someone says, oh, my back hurts, oh, my neck hurts, oh, my shoulders hurt, oh, my hands hurt, my knees hurt, everything hurts, then you have to start asking the question, is there something systemic that's going on that's causing inflammation everywhere? So, and you don't necessarily have to adjust all of them just because they in fact hurt, okay? But when you talk about inflammation, think of this. What does medicine tell you to do when it comes to inflammation? They tell you to suppress it. They tell you to ice. They tell you to say to take NSAIDs. Some of them also SSRIs, corticosteroids, and to also rest. So non-steroidal anti-inflammatory drugs. This is something I had so much systemic inflammation growing up, and I would just pop 4 to 6 Advil every single day just to be able to play sports. And one of the things I didn't realize is I was doing things that was driving chronic systemic inflammation. Yep, and it caused some issues with my health, especially. But the other thing too is almost as if, if you have chronic pain that's being driven by chronic inflammation, yes, you're going to see some changes in the brain. And then just said, well, we'll just put you on some antidepressants, or we'll put you on some steroid medication and just rest that area. And in fact, basically what they tell you to do is they tell you to numb it and try to suppress it as much as possible. Okay. Which leads me to this. And in fact, I talk about this in the inflammation talk as I say, the thing that runs parallel with medicine, with our approach, is that we know that inflammation is a big problem, but the difference is how we're handling it. And so this is why I want to talk about how to get a baby to stop crying. So I have a 2-year-old. I tried to lay down for a nap today and I just heard him crying. But how do you get a baby to stop crying? Well, here's a couple of things that you can do. Okay. Number one, you can cut out their tongue so that they can't cry anymore, which is kind of like what medicine actually does, because someone's coming in, their immune system is giving you a high alert. Hey, something's wrong. Something needs to be inflamed. There's tissue damage that's going on, or there's something that's going on. And they just say, well, let's just block it. Let's just numb it. Let's try to suppress it. Or number two, you want to figure out the reason why the baby is crying. So I think that that's a better approach than to just cut out the tongue, because if you do that, you will absolutely stop the baby from crying, but it doesn't get to the reason why it was crying in the first place. So this is why you need to start looking at it a little bit differently. Okay. And in fact, it's kind of like this, because a lot of people are kind of catching on that this is not something that I want to be doing, but it would be kind of like this. And we've given this analogy before, is that you're driving your car and the check engine light comes on, which means there's a problem with the engine. And you say, oh, I know how to handle this. Let's just get a piece of tape, put some tape over the check engine light, and my problem is solved. And we do that with so many different things. And even with supplements, we even do that too. But you're going to understand is even though you can't see the check engine light anymore, it doesn't necessarily take away the problem. Like this doesn't necessarily fix it. That's why when people have terrible chronic debilitating, joint issues or chronic pain or things like that, they even say, well, I don't want to take a non-steroidal anti-inflammatory drug like Advil, Tylenol, Aleve, or aspirin or something like that, but can I take some turmeric? And I'm like, well, that can help you. There's no doubt about it. But let's get to the reason why that's happening. That's the first and foremost thing that you need to start doing. So you just can't put some tape over it that doesn't solve your problems. So this comes from the American Association of the Advancement of Science. This is an article, a really, really good article, and you can go look this up, but this is about 3 years old. I have talked about this in the past. Title of the article is this: Anti-inflammatory medications raise the risk of chronic back pain in patients. You mean to tell me, Dr. Thompson, that taking non-steroidal anti-inflammatory drugs can actually make chronic pain worse? Yes, it absolutely can. This is talked about now, chronic back pain. They talked about chronic neck pain and headaches, how non-steroidal anti-inflammatory drugs can actually make this worse. But if you look at this article and you can go ahead and read this article, but I'm going to point out some things to you, what they said in this article. Number one, subjects who showed a higher percentage of neutrophils in their white blood cells during the acute stage of pain had a lower risk of chronic back pain later on in life. Okay. This is very, very important, because you got different types of white blood cells. They all have different functions. And if you look at neutrophils are actually responsible when there's tissue damage. So basically what they're saying is if you are having very, very low neutrophils during an acute reaction, is that you're just never going to have resolution, and this is not going to heal. And it's going to become very, very chronic. Okay. And here's what they also said. This proves a point that I've been talking about for years. we've clearly demonstrated that if the immune response is not strong enough, chronic pain is quite common after an acute episode, independently from other factors. Yes, there's more than one cause of chronic pain, but one of the things that they're actually saying is if you don't have a strong immune system, then resolution is never ever going to happen. And this can also be said too, as people ask me all the time about long COVID, and I'm like, if you have long COVID, you have a poor immune system response. You just haven't gotten over the initial infection of COVID. So this is why having a proper immune system response, a normal immune system response, not being having low cells. In fact, neutrophils are just one of them, but you got to look at the monocytes or the macrophages. You got to look at the CD8 cells, CD4 cells. All those are really important in order to really see how well you can overcome a virus. But this is also true even when you're talking about tissue injury and things like that. So chronic pain, basically what they're saying is that you have a lowered immune system response. Now you got to figure out, well, what's lowering down that immune system response? And this goes back to the whole chiropractic principle of stress, mental and physical stress. Another thing too that can really blow through those neutrophils is having high elevated blood sugars. And this is why you will see people with elevated blood sugars, high A1C, high blood glucose, especially for long periods of time, how that actually can cause people to become immunocompromised because elevated blood sugars cause an increase in damage to those neutrophils, which are actually responsible for any kind of acute injury. But the other thing too that can really slam the immune system is a lack of sleep, because sleep is critical when you talk about repair and recovery, and also building a healthy, normal immune system response. And that's one thing that I refuse to skimp on is my sleep. Last night I got 8 hours, fell asleep at about 10 o'clock, woke up like clockwork at 8 o'clock, or 6 o'clock this morning. And you need adequate sleep for repair and for recovery in order to support your immune system as well. But this is also why having elevated blood sugars can really cause a lot of issues when it comes to your joints and things like that. This is why if you look at the people who are getting the knee replacements, the hip replacements, things like that, they all have some level of blood sugar issues. And in fact, I find it odd that doctors aren't even dealing with this as far as helping a person overcome blood sugar issues on their own without giving them all kinds of pharmaceuticals for it. Okay. Now, in relation to this, I will tell you this. COVID proved this. COVID proved this because if you look at the people who are getting bowled over by a virus, it was the people who had the weakest immune system responses. Okay. But think of this. In fact, guys, I have this picture up here, but man, if you see a person still driving around with a mask in their car, don't say anything, but just understand is that if you do that, you look ridiculous. But you see how medicine just didn't do anything in order to make people stronger. Their answer wasn't to strengthen the host. It was just to weaken the environment. And in fact, that's one of the biggest things that I tell people is we strengthen the person to be able to withstand any environment. Because I believe that our human bodies were designed and created by God to be able to withstand a host of stressors and things that come and challenge our immune system. But they never said anything about that with COVID. It was completely devoid, and it didn't have anything to do with check your immune system function. Let's figure out why your immune system is low. It was healthcare communism, and let's make everybody suffer. So it didn't have anything to do with strengthening the host. It was just trying to weaken the environment. So here's what you need to do, because a lot of people, when they're having issues or they say, I'm getting older, rather than try to strengthen their bodies, one of the things they try to do is they try to make their environment a whole heck of a lot weaker. And that's when you start to go silently in the night. That's when you really, really start to go, is when you make that decision. Okay. So if you're talking about chronic pain, I'm going to tell you this. Here's where you need to look at is think of alignment, movement, and labs. Alignment, movement, and labs. That's what I'm going to talk about tonight. Okay. First thing I want to talk about is I want to talk about alignment. Okay. Things have to align up with gravity. There's no doubt about it. No different than your wheels of your car have to be in proper alignment. If you look at this, one of the things you see is you see the tires starting to wear down abnormally. Okay. So if your tires are wearing down, you're seeing an abnormal wear pattern on your tires, then you have two things that you can do. You may need to go get new tires, yes, but the other thing that you need to do too is you need to check the alignment of those tires. I'm going to give you a perfect example. This happened probably, gosh, I don't know, maybe a year and a half ago. And I like to think of myself as a good driver, but in this case, I drove over a curb. I just didn't see it, kind of miscalculated, drove over a curb, and I did some damage to my axle. So I went and got it fixed. And so they said that they fixed the axle, but they didn't realize that the tires were still out of alignment. And in fact, I drove about 3,000 miles and my front tires just went completely bare. And I'm like, oh man, there's still a problem with the alignment. So I took it to a new repair place and I said, I need new tires. But before you do that, please check the alignment. So they checked the alignment and said, yeah, it's way, way off. And I need to get I needed to get the tires replaced. But when they replaced the tires, they also made sure it was in alignment so that it wasn't wearing down abnormally. This is why alignment is so important. But this is what most people do. They have poor alignment, and rather than fix the alignment, they just park their car in the garage for 3 months, and they come out 3 months later and say, see, look, my tires aren't wearing down at all, so that must be working. But we are required to have some level of movement, some level of fitness, some level of exercise. And so that's why alignment is so, so important, because if you have proper alignment, the bones actually are healing, the joints are actually healing. But if you don't, it's just a constant, never ending pressure that can cause the joints to start to wear down prematurely. Okay. Let me give you a perfect example. These are x-rays, and these are pretty common that we will take on people. And here's someone who is living with just chronic debilitating joint pain. And it was just really, really bad. But if you look at this, there's a normal position that your spine has to be in. And in that abnormal position, the only thing that it's doing, and if you're not even talking about neurology, because here's the eyes, here's the teeth, here's the back of the head, then you have the brainstem and the spinal cord that are running through here. And this right here, these are the bones of this person's neck. And the red line actually means this is the normal position of where it needs to be in. So in an abnormal position, this is just causing wear and tearing of the neck. Now, if you talk about neurology, this will actually cause tethering of the spinal cord, because the spinal cord is attached up here. It's also attached down the lower part of the spine. And anytime that you're losing a curve into the neck, it just causes stretching of the spinal cord. And this will cause a lot of issues, especially if you're talking about the inability of the like the vagus nerve, the autonomic nerve system, to be able to regulate itself. So this is where she was in an abnormal position, literally missing 80% of the normal curve in through the neck. And then if you look at the lower part of the back, this is the belly, this is the back, this is the bones of the lower part of the back. And you can see she also was missing most of the curve in through the lower part of the back. And this is just one of these issues that if you start seeing that this is going on, and then you decide to start to do heavy squats, jump rope, a lot of pounding, box jumps, things like that, the only thing that you're doing is just causing this to wear down a whole heck of a lot faster. And this is why you need proper alignment with gravity to make sure that you're not causing tissue damage that can cause things to wear down a little bit quicker. Now, one of the things I want to point out to you is this: turmeric and boswellia and cat's claw, it's not going to fix this. Yes, there are things. Turmeric can help. Boswellia can help. Yes. Cat's claw, yes, can help. And in fact, I only recommend that for as long as until we try to dig a person out of the hole. But yes, you may get initial resolution, but you know what? If you don't fix the reason why that's happening, especially with alignment, the body is pretty smart. It says, I'm going to find a workaround when it comes to this. And that's why there's multiple different reasons why people can be on turmeric or cat's claw or something like that. But I wouldn't be constantly taking that. I would be trying to get to the reason why it's getting inflamed. And alignment can be one of those things. Here's another x-ray of someone's lower back. So here's the belly, here's the back, looking at them from the side. And here's what's interesting is that this person right here, if you look at this and you see missing 66% of the curve in the lower part of the back, the black line is him, and this red line is actually where this should be lined up. And so you can see the difference of where it should be lined up, and you can see how out of alignment it actually was. But what's interesting about this is this person had chronic back pain for 13 years. And in fact, by the time that he came in, he kind of ignored it. And by the time that he had come in, This guy was in a back brace and in a cane and hardly able to work and hardly able to walk for about 3 weeks. This is after about 6 weeks of care. And so one of the things that we did is we did the right things with movement and the right types of adjustments and the right vector of force and then the right home exercises. And you can see the change that took place over 6 weeks. So you can see in a lot better position. But you know what? This isn't about just improving the position. This is about helping people get their life back. But when we took this X-ray, this person was back to work. This person was working out as normal and was actually able to deadlift again too. So this is why alignment is so important. Alignment is so important, guys, because if it's not, then all you're doing is just causing things to wear down, especially if you're pounding on those things all the time. So alignment's number one, and then number two is movement. Proper movement, okay? Now, I want you to think of this. If you injure a joint, you should start safely moving it when? Immediately. That's why if people have a disc injury or something, we get them moving in a safe pattern as quickly as possible. And in fact, research has shown time and time again that when you start immobilizing things after injury, it's just causing problems. And that's why you want to start safely moving things as quickly as possible. And yes, this is even has to do with sprains and ankle sprains and things like that. If you have an ankle sprain, and someone comes in and say, "Oh, I sprained my ankle." You know what I'm going to do? I will adjust it immediately in the acute phase of that in the right vector of force, because there's nothing better that you can do in order to start moving it. And I will have them start walking safely so that they don't re-injure it again as quickly as possible. And time again, one of the things that you've seen is you see that this person comes back. I don't want to say quicker, but yes, quicker than if it's traditionally managed. And one of the reasons why I started to catch on to this was, I mean, if you look at my right ankle, and this is what an ankle sprain looks like a few days after, because you get a lot of bleeding, and a lot of the bleeding just starts to creep down into the bottom of the foot. But I have a completely reconstructed ankle, and I think a lot of the things that drove that was how terrible it was managed when I had those injuries, because the first thing that they did is they casted it, which is now probably one of the worst things you can do, because immobilizing it is not good, and it just caused atrophy. Didn't have an opportunity to be able to rehab it correctly or to connect the nerve system and the ligaments back to the spinal cord in order to develop proper reflexes so that I didn't re-injure it again. But it's I can't make up for it about what happened to me in the past, but I can sure as heck make sure that it's not happening to other people. But the other thing too that can happen too is, I want you to think of this, is that if you fell, you had a Fuchs injury, fall on an outstretched arm or outstretched hand, and you fractured your radius, which would be like this bone right in through here. Well, then yes, you need to have it casted. All right, there's no doubt about it. You need to have it casted. But I want you to think of this: they put the cast on for 6 to 8 weeks. They immobilize it. You can't, use it anymore. Well, what's going to happen? When you get the cast off, even if that bone has formed a union and it's grown back together, you get the cast off, and I want you to think of this: that wrist is stiff, it's weak, the muscles have atrophied, and it will be very painful. So anytime that you can't move things for a long period of time, that area is going to get stiff, weak, and painful. And if you got your cast off and it takes off, you're like, "Hey doc, my wrist is really stiff, weak, and painful." The doctor's not going to look at you and say, "Well, maybe you have arthritis, you shouldn't be using it." But the problem is that if someone comes in and they have a stiff, weak, and painful knee, they're going to go in and they're going to look at that and they're going to say, "Well, you're not a spring chicken anymore, and you shouldn't be moving it." And then what happens is that the more that you start to not move it, the more that you stop moving it, you're not exercising it, then it's almost like a foregone conclusion that it's just going to continue to get worse and worse and worse. And this is why movement can be so important. Okay. That's why in the office, some of the things that we do, especially if people are dealing with some issues, especially in the neck and the lower part of the back, that's why we do things like repetitive cervical traction, get them moving as much as possible. That's why I absolutely love wobble chair. And in fact, you can even get a wobble cushion on Amazon, and you pump it up, so that it's almost like a semicircle in order to decrease the axis in which it rotates. That will just help you be able to move better. Wobble chair, and then adjustments too. Also with the right vector of force. And how do you determine that? Well, look at some x-rays so that, if someone's got a loss of curve in the lumbar spine, this is why applying a force from posterior to anterior, from back to front, can actually help quite a bit. But if someone comes in and they have a hyperlordosis, or they have like a spondylolisthesis in which the bone has shifted forward because of some kind of compression fracture, some kind of stress fracture, in the spine, pushing it forward is not going to make it better. It's actually going to make it worse. And this is why adjustments in the right vector of force can be so beneficial for people. And then, as always with people, we tell them some exercises to do at home based off of their x-rays. We show them how to do it, because we want to not give a person a fish. We want to teach a person to fish. In fact, we want to teach a person how not to need our help down the road, and teach them how to be able to take care of themselves. Okay. So this is why alignment is so important, and movement is so important. But the other thing too is you got to look at some labs. And I'll have this conversation with a lot of people. It's like, well, there's probably a lot of inflammatory things that are just driving chronic pain in certain areas. And this is why you need to be looking at some labs. Okay. And this can also help you determine, is it something that's kind of systemic going on throughout the body, or is it localized? And this is kind of the analogy that I give is, if you have some joint damage and then combine that with systemic inflammation, you're going to feel it first where you have the joint damage. And that's why too, like changing the way that you eat and looking at things that are causing inflammatory triggers inside your body, that can have a profound effect on having systemic inflammation, which then just is attracted to where you've had some damage to your joints because of repeated injury or something like that. Okay. Now, let's talk about some lab values. And it brings me back to a conversation that I had with an individual who came in, was having terrible, terrible back pain, terrible like hip pain radiating down both of her legs. And she was in a cane. And this had been going on for many, many months. Now, here's her x-ray. If you look at this, yeah, the x-rays are pretty bad. In fact, if you would look at one joint that's down at L5, and that usually gives people a lot of problems, you can see just how degenerating it is, slipping backwards. And I looked at this because I looked at her history, and she most likely was a type 2 diabetic. But she had also had a lot of gastrointestinal issues and had Crohn's disease. She walked with the cane. And I looked at her and I said this, I want you to get some labs. The reason why is, yeah, we can keep trying to adjust this area, but if you stay perpetually inflamed, there's just not going to be resolution. And I don't want to keep doing some things and keep banging my head against the desk and somehow popping and praying and hoping that it goes away, when I know there is so much inflammation that's happening in this person. So I said, I want you to get some labs done, and I want you to see if we can do some things from a systemic level in order to start lowering down the inflammation. But just constantly going in to adjust it. This is why, if I know someone is very, very inflamed, and yes, if they need to be adjusted, I said, you know what? If I adjust you, we start moving this, and you are very sore afterwards, check your high sensitivity C-reactive protein, because if it's very elevated, then chances are you get adjusted, and man, you will be sore afterwards just by initiating a little bit of motion into that area. Okay. So this is why some of the best things that you can be measuring for: high sensitivity C-reactive protein. Homocysteine is another one. Looking at your A1C, which is your 90-day average blood sugars. The reason why this is so important is because elevated blood sugars damage neutrophils, which can then, cause incomplete resolution of inflammation. And the other thing too is it just damages the soft tissues, which is why you call advanced glycation end stages, which is why it damages your joint capsules, which it damages your endothelial lining of your blood vessels, your arteries, your arterial system. And this is why, if you look at, people with blood sugar issues, this is why they will have so many issues with cardiovascular disease and things like that. You need to be looking if you are carrying infection that can be driving a chronic inflammatory response. And sometimes this is hiding out in stool. And yes, even your hormones as well. And so I've had women come in and they're like, oh man, everything was good. And then I hit menopause and then all my joints hurt. And I tell them this, I'm like, well, just remember this. If you hit menopause, your estradiol levels are going down. Just remember, estrogens have an anti-inflammatory effect, which is why women will catch up with men when it comes to heart disease after menopause. But it's not the cause of all of your problems. I had a woman say, "Oh, my shoulder hurts because I'm in menopause," and I'm like, "No, it hurts because there has to be something that is initiating your immune systems to try to clean up some damage. That's the real issue. Don't blame it all necessarily on your hormones." So everybody wants to blame their hormones for everything, for everything. But just remember, you got to have something that's going to cause an inflammatory response. Maybe your hormones were blocking a lot of dysfunction that was going on, which is also the same reason why, if a lot of women have a lot of uh, inflammatory triggers that are going on, and then, after menopause, they see their, cholesterol levels jump up and things like that. The hormones were keeping it kind of under control. And then you go through the natural phase of menopause, then it becomes a really, really bad day. But the other thing too is that you have to look at vitamin D. Chronically low vitamin D levels will cause a lot of chronic pain. And I checked my vitamin D levels. Last time I checked, they were at 104. So my vitamin D levels were doing really, really good. And I don't have any kind of chronic pain or anything like that. But if you look at Frontiers in Immunology from a couple of years ago, they talked about vitamin D and its potential interplay with pain signaling pathways. So this is why being low in vitamin D can have an effect on your inflammatory levels. The biggest thing that vitamin D will play a role in is in the adaptive immune system and the ability to be able to turn off an inflammatory response. So there's multiple things that are at play here, especially when you're talking about chronic pain. And a lot of times I see people when they come in, their vitamin D levels are so low. In fact, last time I checked it on someone, they were at like 18. And normally I want to see vitamin D levels, at 60, 70, 80, sometimes even higher in some people, depending on what they're dealing with as well. But here's an interesting lab example that you see going on. And here's a person who came in with just terrible pain. And in fact, she called it fibromyalgia. She dealt with fibromyalgia. Depression, was basically bedridden, and, had terrible, terrible joint pain. And I said, get some labs done. We'll look at your x-rays too. When he got her labs back, she was a diabetic, causing a lot of joint issues. Her C-reactive protein was very, very elevated. This should be under 3, and it was at 5.7. But here is the thing that was really driving this was her homocysteine levels. These things should be probably at about 8 or 9, and they were over 50. In fact, it was so high that the lab just couldn't even measure it anymore. And every time that I see people with very, very high homocysteine levels, and yeah, you can blame your MTHFR, you can blame all of that. But really what this means is that she wasn't detoxing very well, needed very, very high dose of, methylfolate, B12, methylated B12. And I gave her super high amounts of liver, super high amounts of B9, B12. But you know what? Also, I've actually have seen very high levels of homocysteine levels. This may get me banned off of YouTube, but who cares? Is after the COV, et cetera, jibby jab, because I've seen people have a real heck of a time trying to deal with this, and I've seen their homocysteine levels go from normal up to over 30, and then that's just causing a really, really bad day. In fact, elevated homocysteine levels I have seen this repeatedly with high levels of fibromyalgia, depression, just poor energy, things like that. So we started giving her very high levels of B9, B12, liver, things like that. And within 6 weeks, she comes into the office. She's like, what kind of witchcraft are you working on me? Because she was literally bedridden. She was able to start CrossFitting, scaled, of course, start CrossFitting after about 6 weeks. So these are some lab markers that are really saying, hey, your body's having a really, really tough go of it, and you need to start getting some of these things under control. Because here are her x-rays, eyes, teeth, back of the head, and you can see how much joint destruction was taking place. And then here's her x-ray of her from the back, and you can see what her spine was doing. You can see there's a scoliosis that's going on. You can also see that she had a lot of abdominal surgeries, going on. And this right here, this is traditional medical management, which is just basically just cut you open and staple a lot of things out. But you can see within 6 weeks, we got her to the point where she was able to get out of bed, start exercising, and not be absolutely crushed by it. Okay. So think about chronic pain. What causes chronic pain? Well, this is the whole chiropractic principle right here is The body is designed to heal, but it can't if you have too many mental, chemical, and physical stressors that are going on. So this is why mental stress is absolutely just, it can just debilitate a person. And I see this affected quite a bit, especially when you talk about women, because yes, women do stress out more than men. It's how you're built. But if you have a lot of chemical issues and a lot of physical issues, and this is why you have to start looking at all of those different things. This right here, this is true healthcare. True healthcare is someone who's going to start taking care of the person rather than just say, well, let's just get you adjusted 60 times and hopefully it gets better, because it's not. You have to have, you have to correct things with how they're moving, how they're lined up with gravity, but you also have to take an approach in which you know exactly what you need to be doing in order to start lowering down chemical stressors and mental stressors as well. Just remember, the body's designed to heal, and it will heal as long as there's not too many of these stressors that are going on. Okay. So number one, look at x-rays. So get some x-rays done. And this is something that we do in our office all the time. Get your appropriate labs done. And this is why someone comes in, I'll say, I want you getting these labs done. And we actually do the labs. We do the blood draw in our office. Okay. Start moving, obviously, correctly, and start fixing your lifestyle. And in order to accomplish that, you really do need to be working with a Wellness Way doctor. I know people are going to reach out with me, and I'm only working with people who are in the Chicagoland area. Um, but there are multiple doctors that are out there, if you just go to wellnessway.com, who can work with you remotely as well. However, one of the reasons why I want to work with people on a one-on-one level, be able to see them face to face, is just because if people need help with me specifically as a chiropractor in order to start adjusting them and start getting things moving the way that it's supposed to, we just see people get better so much faster because we're really good at removing a big time stressor that's affecting not only the joints, but also the nerve system as well. Okay. Here's a final thought. Don't expect an oil change when you need an engine overhaul. I see this all the time. People think, well, all you got to do is just move this into position and all my problems are going to go away. I wish it were that simple, but there's a lot of people who are coming in and they think all I need is just a little oil change, when in reality, what they need is they need an engine overhaul. And I'm always trying to figure out not what's the least I can do in order to help this person and make them happy with me. It's always, what's the best I can do for that person? What is the best that I can do? And every single person who comes in, I treat them as if they are my mom or my dad. I like, what is the best that I can do to make sure that they're having victory over their health problem? But I also make them take accountability and take responsibility for their life and for their health. So don't just come in thinking you need an oil change, when in reality, there's a lot of people who just need an engine overhaul. Which reminds me of this. Get registered for the inflammation event that's coming up Tuesday, June 10th. That's tomorrow at 6:00 p.m. If you're from the Chicagoland area, or you're watching from Yorkville or from the neighboring towns, make sure that you just go to our Linktree profile. You'll see this pop up when you click on that and get registered for our next inflammation event, which will be tomorrow. If you can't make it, just pay attention to that, because our next one will be 3 weeks from that time. But start working on your health now. The biggest thing I tell people is, you should have planted this tree 10 years ago, but the next best time to do it is right now. So don't delay. Make sure you get registered for that inflammation event. And I guarantee you, to help you start to understand what you need to be doing in order to start moving your health forward from a lot different perspective. Just as a reminder, I will be going live next week, understanding POTS, postural orthostatic tachycardia syndrome. So I will be talking about that in detail and some of the biggest triggers that can do it. There's problems with posture, probably ligament instability, with even mold mycotoxicity, infection, things like that are going to change your immune system. They're going to change your nerve system. They're going to change your adrenal glands. And that's because that's happening. This is why you have such a hard time as far as getting up from a seated position, from a laying down position, and just causing your heartbeat. But this can be absolutely debilitating for so many people. And that's why you need to start looking at it from a different perspective. So make sure, if you don't follow our page, follow our page, subscribe to our page to be updated when we're going to be going live next. But make sure that you get on that next live video, which will be next Monday. I always say 7 o'clock. I always go earlier only because I just don't want to sit around here in the office. I do have a family. I do have a little boy that I want to say goodnight to and say goodnight to my kids as well. But I will be going live next week. Make sure you tune in for that live video that'll be coming up. It's very, very important. So guys, thank you so much for tuning in. I hope this helped you quite a bit when it comes to chronic pain, but make sure too that if you're from the Chicagoland area, get registered for our next inflammation event. I think this will be a great thing, and this will start your clearing a path to healthier, happier you. Especially, I know a lot of people do deal with chronic pain, but this is your way in order to start helping it appropriately and start to clear a path for a happier, healthier life. So, guys, I appreciate all of you. Please make sure you share this video with other people. Help that person, because imagine, I had a conversation with the woman. She's off of thyroid medications. She's like, this is the best that I felt in years. And I looked at her and I said this, imagine if we never met. She's like, oh man. Oh man. She's like, I don't know where my life would be at this point. Well, this is your chance to be able to start moving in the right direction. So please make sure you share this video and help some people who are suffering when they don't need to. So guys, be well, be blessed. As I always say, remember who you are. We'll see you back here next week.